Hi everybody, and welcome to our Facebook live stream. And I hope that you had a wonderful week and you're looking forward to a wonderful weekend. Today I'm going to talk to you about a procedure that is in the regenerative medicine world. And this procedure is for women, and it helps women with stress urinary incontinence and even with sexual health. And we're going to talk about all the details of that. It's a fantastic procedure. I do want to let you know that we're discussing female intimacy related to this procedure, so if that's outside of your comfort zone, just wanted you to have a heads up. Really scientific, and we're going to be explaining the procedure. But if that's not something that you would like to join us for today, that's fine. Just letting you know ahead of time. But this is a really exciting procedure, and if there's any woman, if you're a woman, or if there's any woman in your life who probably doesn't talk about it very much, but those little stress leaks that happen, we call it stress urinary incontinence, where just sneezing, coughing, laughing, jogging, exercise, any little thing that could cause that contraction can actually result in urinary leaks, which becomes a real problem for a lot of reasons. Obviously, the hygiene and the embarrassment of having to deal with that, and then wearing pads all the time just to be able to make sure that you're not having leakage through the clothes and things like that. It's really a quality of life issue for a lot of women. It's very common to have this occur after having children, but it still happens in women at usually a certain age, even if they haven't had children, because the pelvic floor starts to just become more relaxed, and it's not holding things the way that it used to. So this happens for a lot of women, not just women who've had children or or things like that, and it can start younger and younger. So this procedure is called the O-shot, and I'm going to talk about in details about the O-shot. The O-shot is a tremendously safe, effective procedure for stress urinary incontinence, and also another condition that a lot of women don't talk about very much is the female sexual. It's like a hypoorgasmia, or problems in the sexual health realm where they really don't have a very satisfying life in intimacy life. And this procedure can actually help with both of those things. And for women who have had breast cancer especially, and they can't have, all of their estrogens have to be blocked, or they can't have estrogen, they can have a lot of vaginal irritation, dryness, atrophy, and this procedure is very safe for those women and can really help with those symptoms. So I'm going to talk a little briefly about the current options that women have. I'm going to mention them here, and then I'm going to talk about them a little bit more in detail a little bit later. But right now, what are the options for women that have stress urinary incontinence? Well, there's physical therapy, pelvic floor exercises, there's medications, there's a couple of other procedures that involve radiofrequency, and there's actually an injection of coapatite, which is a bulking substance around the urethra to try to give it more support so that the urethra doesn't leak urine. But out of all of those, the O-shot, which we're going to talk about in detail, is really utilizing your own growth factors, and it has all these other benefits and very, very, very low risk when done properly. So let me tell you about one of my patients. My patient Elaine had been having urinary leaks for years. Now, she was told they weren't bad enough for surgery, like a pelvic floor surgery, so she could take medication or she could just wear pads every day. So she was concerned about the medication side effects. So she'd been wearing little pads every day since she never knew whether a sneeze or a cough or even a laugh was going to happen and cause urine to leak. She was so self-conscious of smell and hygiene, but she didn't know what else to do. She had stopped exercising because that caused leaks as well. She wasn't incontinent, but she didn't have the control over her bladder and the urinary leakage that she used to. So I discussed the O-shot with her, and she was nervous about injections in such a delicate area, but we use numbing cream and a nerve block. It's really super easy, straightforward, and really not painful. I did one O-shot for her, and within 2 weeks, she was really starting to notice that her urinary leaks were less. And at 4 weeks, she didn't have them at all. She no longer needed to worry about wearing those little pads, hygiene, and avoiding activities, and she was so, so happy. She's since returned once per year to repeat the O-shot as kind of a tune-up to keep her active lifestyle without leaks. And I have another patient who came to me, Laura. Now, Laura was having problems with intercourse and some urinary leaks, and she just had a lot of pain during intercourse, and this was creating a real problem with her marriage because it was just so difficult for her to have that intimacy with her husband because it was very painful. And she came to me, we talked about the O-shot, and I found on exam that she actually had a condition called lichen sclerosis, which I'll talk about a little bit more later on. But lichen sclerosis is a scarring that happens for some women. It's actually considered an autoimmune phenomenon and condition, but it's a scarring of the vaginal tissues, which can be scar tissue, as you know, it has no pliability to it. So it causes this constriction and this scarring over of a lot of the vaginal tissue. She didn't even know she had it. And the O-shot is something that has really been studied in lichen sclerosis and with excellent outcomes. So I actually did 2 O-shots for her, which is common with lichen sclerosis, and she within 3 months, she had significant improvement. It wasn't all gone, but it was so much better that it was changing the dynamic with her husband. And, life just took on a whole new avenue for her that she had never had before. So this O-shot is really amazing. So let me talk a little bit about, a little more detail about the current options to reduce stress incontinence and improve sexual health in women. Most of these are actually about reducing stress incontinence. Improving sexual health for women has really not been a subject that's been given a lot of time and attention in the research, although now there's a lot more procedures and things like, for example, O-shot, that can really help in that department. The traditional therapies to help with stress incontinence are the physical therapy, like pelvic floor exercises, and there are some technologies that help, such as the Emsella chair, which is a HiFem. It's a special kind of signal that helps to strengthen the pelvic floor. It takes multiple sessions of the Emsella, but it is non-invasive, sitting on a chair. And so that's one of the things that's in the market. A lot of people don't know about that. It's kind of newer technology. There is the injection of the coaptite, which is these injections of a bulking substance around the urethra. So that is trying to help support the pelvic floor. There's also radiofrequency procedures, which are considered minimally invasive, but there's a special radiofrequency probe that's involved, so it's not totally non-invasive. But those are fairly new on the market as well. But more common even than those things that I've just mentioned are the anticholinergic medications. So sometimes they're called bladder antispasmodics, but they're mostly in this group of anticholinergic medications. And the problem with these is not that they don't help some women, or maybe even a lot of women, but they have significant side effects. Just the side effects that they experience while taking the medication is severe dry mouth, dry mucous membranes, dizziness, and forgetfulness, and some of the patients can even feel the cognitive decline. And now there's an increased risk for dementia, which is very well documented in the literature with these medications. So let me show you just 2 studies that looked at this risk, just so that you can see. This is not a new concern. This has actually been around for a little while. So this is one study that was done about anticholinergic drugs and the risk of dementia. This is a case-controlled study. And basically, there's a lot here, but what I want to show you is essentially the results that they found were that this is the anticholinergic cognitive burden score, and this ranks the different medications that have anticholinergic properties in them with the risk of cognitive decline. And many of the urinary incontinence medications have a score of 3, and so these were really concerning. So it was observed for exposure of 15 to 20 years, even before diagnosis, and that's where really a lot of the concern comes from. So the conclusions is a robust association between some classes of anticholinergic drugs and future dementia incidence was observed. It could be caused by a class-specific effect or drugs being used for very early symptoms of dementia, but future research really needs to be done on these drugs. And this is this is only one study. And what you'll find if you start looking at these studies is the elderly, the older we get, the more this is concerning. Not just because older people get dementia, it's not that. It's that older people are more sensitive to these anticholinergic side effects. There's another study here, anticholinergic medications and the risk of dementia in older adults. Where are we now? This was just published. And this is again, relevant literature. They're looking back through all of the studies. Expert opinion. Strong risk of dementia with anticholinergic use in multiple studies involving older adults. Irrespective of the study design, the anticholinergic exposure, and outcome definition, they're saying that they're really concerned about this. Based on the current evidence, regular assessment and optimization of anticholinergic burden, that's what I was telling you about, how they rank those anticholinergic drugs prior to prescribing these medications, could minimize the morbidity associated with those drugs in older adults. So it's not something that we shouldn't be taking very seriously. So if those things have those kinds of side effects that we'd like to avoid, not everybody can avoid them. Obviously, some of the medications have worked really well, but I just like you to know that there's concern about these. And if we have something that's very safe and effective that doesn't have that kind of risk profile, then I just want you to know about it. So what is the O-shot? The O-shot is a procedure in which we do a simple blood draw. We isolate your own platelets. I've talked about platelets before. Those are the components in your blood that have a lot of growth factors, a lot of cell signaling factors. They are a big part of the healing process and to improve blood flow to an area. So we isolate the platelets, which contain all those tremendous healing and regenerative capabilities. We concentrate them, we activate them, and then we inject them in a very, very specific way into the anterior vaginal wall, the clitoris, and these tissues that are associated with protecting you from that stress urinary incontinence and with the whole female sexual response. So why would PRP improve urinary stress incontinence? Well, let me show you a diagram. So this diagram shows, this is actually out of one of our most famous and well-known anatomy illustrators, Frank Netter. And this is where, if you'll see here, the vagina is here, and the urethra is above it. So this is the urethra, and this is where the urine comes out. The bladder is way over here. And so you can see that there's a pretty intimate relationship between the vagina, especially the upper wall here, and the urethra. So these are Skene's glands. These have some functions that we know about and some functions we're not quite sure about, but there's definitely a lubrication involved with these glands. And when you support the health of this tissue here in the anterior vaginal wall, you give a tremendous amount of support to the urethra, which you want to be able to control that so that the urinary leaks don't come out when you don't want them to. So I thought this was kind of a nice diagram to show you how are they related. This is how they're related. And so there's also the condition that I mentioned called lichen sclerosis, which is that autoimmune condition. It causes scarring to occur in the female genitalia. Some women develop so much scar that it actually occludes the vaginal opening by a lot or covers the clitoris completely, and that creates it makes it insensate. They can't feel anything there. The O-shot is one of the very few procedures that can actually help this situation due to the truly regenerative properties of PRP. The PRP can actually remodel scar tissue and provide new blood flow to these tissues. So let me show you what I mean. I've got some microscopic slides about lichen sclerosis I want to show you. So this is normal tissue. This is normalized after actually being treated with O-shot. This is what it's supposed to look like, okay? You can see this thin layer here. This is a normal amount of keratosis at the surface, and this is hyperkeratosis. It's very thick. It's not, look at the barrier between the healthy tissue underneath and the surface. So this is what lichen sclerosis looks like under a microscope. And here's another example. This one is even more dramatic. Look at all of this hyperkeratosis. This is that thickened scar tissue that with all the stuff underneath, there's a barrier here to all the tissues underneath, and this scar tissue becomes tight and inflexible, and it can constrict, and it can really cause a lot of problems. This is what it's supposed to look like, and this is what can be accomplished with O-shot. Now, usually it takes more than 1 or 2 procedures. This is a reversal of a scarring process that's usually happened over many years, but it's still very, very safe. If you just start doing surgery on that tissue, the propensity to form more scar is always there, and that's the concern. But with O-shot, you're using PRP to help regenerate these tissues and rejuvenate them and modify that scar tissue. So it's very exciting. So those are a few instances, and as I mentioned before, with women who have had breast cancer, or usually that's the situation where their estrogens need to be blocked, or they're not allowed to take estrogen. And the estrogens really help with maintaining the environment of the vagina so that it's not dry and painful and sometimes itchy, and the mucosa is not, degenerating and becoming atrophic. The O-shot is safe for that. So you can help restore without any risks or any concerns about breast cancer. You can help restore just that tissue that's really suffering from the loss of natural hormones. So let me just take you over here to the there's some commonly asked questions about O-shot, and I have this on my website, but I want to show you a little bit about this here. So how long does it take? It takes about 20 minutes. There's a process of numbing. We let some numbing cream work, and then the process itself, and we do the blood draw, but the actual procedure doesn't take very long. How long does it last? About 1 to 3 years. We do have, it a little bit depends on how much stress incontinence you have when coming in. Sometimes people prefer to repeat it more than once a year, but most of our patients like to repeat it about once a year. And then if you're really a lot younger, or you really have very, very mild symptoms, it may actually last quite a bit longer. So this is how it works. Very important to be a certified O-shot provider. It's not just putting PRP in the anterior vaginal wall. You need to know exactly how to do this procedure. If you use too much or you put it in the wrong place, you could cause some damage in that area. One thing that could happen is you could obstruct the urethra. So this procedure was designed and invented by Dr. Charles Runnels with a very specific protocol. So you want to make sure that if you're not in our area, that you go on the O-shot provider site and make sure you choose a certified O-shot provider. Also, how you process PRP is not the same. When you're a certified O-shot provider, all of that has been determined, and it's part of the protocol. So who's it best for? Really, about women anywhere from age 40 to 70. Although if younger women are having some pelvic floor, they're having some stress incontinence, there's no reason that you couldn't do this procedure in a younger woman, and there's no reason you couldn't do it in an older woman either. But this is the age range that seems to get a tremendous benefit that lasts, past 6 months, maybe beyond a year. Usually, when will I notice a difference? Usually within anywhere from 2 to 6 days is when that the clitoris kind of wakes up, and there's that significant increase in sensitivity there. And at about 1 to 2 weeks, it's usually about 2 weeks, is when that stress urinary incontinence starts to get better. And at 4 weeks, it's usually kind of peaking with how good it's going to get. But there are some people who will continue to improve, because the PRP has a whole growth phase and things that it goes through. So it could be even up to 2 months where you're starting to see really where it's maximizing out at 2 months for some. Risks? Well, I mean, every person's coming in with a different baseline state of health, but this is considered a very low risk procedure as long as it's done properly, as I had already mentioned. And is it painful? Most patients, believe it or not, I know it's hard to imagine that it doesn't hurt, but believe it or not, most patients report it to be, if not painless, almost painless. The nervousness about having a procedure done in such a sensitive area is a big part of just getting past that. The numbing cream we use is amazing. There is a nerve block that can really, really take things, take any discomfort really out of the procedure. We don't have to do the nerve block. For some patients, I've done it without because they preferred that. But even then, it really was not bad. I promise. It's not painful. It's not considered painful. How will I feel immediately after? You might have a little bump, you might have a little increased in sensitivity that happens right away. There's a phase to PRP that we don't fully understand, that as soon as it hits the system, it has kind of this interesting release of wonderful things, and it starts a cellular process. And sometimes that's noticed by patients as, it's just to feel a little bit better, or that they're kind of sensitized in a good way. Small chance of bruising, and anytime we put a needle in the skin or in the mucous membranes, there's a chance of bruising, but it's really rare. And so the FDA, I get asked this a lot, the FDA doesn't oversee our body tissues. It governs medications and devices. So all of the devices that are used are FDA approved, but this kind of procedure where you're using your own blood products in PRP, that's not under the purview of the FDA. That's the practice of medicine. Who should not have this procedure? Well, it's not that it's harmful for anybody, but for women who have severe incontinence, for example, have to wear a full Depends because they don't even realize that urine is coming out of them, or if they have a neurogenic bladder from a stroke or a spinal cord injury where there's just no control over the bladder at all, the O-shot's not likely going to help with that, even if we did several of them. It's not that it's not, for some women they say, I only have a 50% chance of it helping, but there isn't anything else being offered to me and I would like to try. I don't have a problem trying it for people, but I like to really manage expectations that if the incontinence is severe, it may either take multiple O-shots done, 6 weeks, 2 months apart, or it's just maybe not going to be enough if there's just so much that's not working properly. And so this is just a video I did. You can get to this page by going to drheather.net/O-shot. So isn't that wonderful? That a procedure as natural as O-shot, which uses your own growth factors to recover tissues and help with these particular quality of life measures, less or no urinary leaks, better intimacy, less dryness and atrophy for breast cancer survivors who can't take estrogens. Now, some people have asked me, how did you go from helping people with pain and doing regenerative medicine to procedures for sexual health and urinary leaks like O-shot? And what I tell them is, well, I followed the PRP. I'm such a regenerative doc through and through that everything with PRP or cellular biologics that can help, I'm interested in. So for more information and to look at those frequently asked questions in detail, I tried to think of everything that I've been asked or everything that I would want to know and put it in there for you. Go to drheather.net/O-shot. If you're one of my patients and you are interested in an O-shot after seeing this video and reading what's on the website, you can go to drheather.net/contact and then select or mention O-shot. And if you're not yet a patient of mine but are interested in becoming one, you live in Florida, at least part of the year, go to drheather.net/new patient. So it's been wonderful having you with me. I guess I'm always humbled that you come and spend a little time and trying to open horizons and teach you things maybe you didn't know, and things you did know about, maybe you learned a little bit more about it. Feel free to let me know, what's interesting to you and what kinds of things you'd like to hear about on these live streams, because I'm really here to serve you. So I hope you have a wonderful weekend, and I'll see you next Friday. Bye for now.